Ozempic is one of the most famous brands in medicine. Ozempic! But what if it got too famous? Okay, so I'm here in Kendall Square, Cambridge, Massachusetts, very much the epicenter and hub of biotech and pharmaceuticals here in the United States. And I'm here to ask a bunch of biotech workers on their lunch break, going to pick up various slop bowls from Chipotle or Sweetgreen or whatever. You know those weight loss shots? What are those called? So, you know the shots that people take to lose weight? Like, what are those called?
Ozempic.
Thank you very much.
Ozempic?
Thank you.
Like Ozempic?
Yeah. Ozempic?
Now, if there's anywhere in the entire country people should know the answer to this question, it's here in Kendall Square.
Ozempic or Wegovy?
Excellent.
Ozempic.
Wegovy.
Oh, good one. Most people say Ozempic. That's the point of the video. Thank you very much.
Ozempic?
Thank you very much.
Oh, Ozempic?
Oh, that's Ozempic.
Thank you very much. Yeah. So, clearly when most people think weight loss drugs, they think Ozempic, which is interesting for a couple reasons. For one, Ozempic is not marketed as a weight loss drug. It's marketed for type 2 diabetes. A lot of the confusion comes from the fact that the exact same medication is also sold for weight loss under the name Wegovy, which a couple people did mention in Kendall Square. And just for the record, other answers that the judges would have accepted include Eli Lilly's Zepbound, GLP-1s, semaglutide, or tirzepatide. So why is it interesting that Ozempic has become shorthand for GLP-1 weight loss drugs? There are tons of words we use every day that are, or were at one time, trademark brand names. To show you what I mean, let's take another trip to Cambridge, this time to the Lynch family skate park. But before we go shredding, I'd like to quickly reintroduce Status Report, this new weekly video series from Stat. Each episode takes viewers inside the biggest stories in health and science, breaking down complex topics, doing dispatches from the most important events in life sciences, and talking with stat reporters and the experts shaping the future of medicine. I'm really excited about it. We have a lot of great episodes planned, and it's going to be a lot of fun. It's not always going to be a lot of fun. Stat covers some pretty heavy stuff. But I do promise it'll always be interesting. So if this all sounds good, I'd really appreciate it if you'd like and subscribe. It's a little click, but it helps us out a lot. Okay, let's roll out to the skate park. It's a beautiful day to do some inline skating. You may be wondering why I said inline skating and not rollerblading. Well, that's because rollerblade is a brand name. And if rollerblade became the generic term for inline skating, the brand rollerblade could lose its trademark.
Hey Alex, you're like 40, right?
Huh?
You worried about getting hurt?
Oh, don't worry about that. I brought some aspirin and a band-aid. Nothing like doing a couple grinds on a beautiful fall day. So anyway, when a brand name becomes the generic term for an entire category of products, the company is at risk of losing their trademark. For this reason, companies often aggressively protect their trademarks. Some have done so successfully. The parent companies of Rollerblade and Band-Aid, for example, still maintain those trademarks. But others, like aspirin, thermos, and dumpster, have actually had their trademarks revoked. So I want to know if something like this could happen to a drug like Ozempic, which has started to become shorthand for a whole class of medicines. I asked Professor Robin Feldman of UC Law San Francisco for her thoughts. Feldman is an expert on intellectual property and healthcare law. Professor Feldman, thanks so much for joining me.
It's nice to be here.
I went out and I asked a bunch of people in Kendall Square, which as you know is like the hub of biotech here in the US, and asked people what the weight loss shots are called. And even in Kendall Square, almost everyone said Ozempic. If you were the trademark lawyers at Novo Nordisk, which is the maker of Ozempic, would that worry you?
Oh,
Oh, I would be terrified if that's what I heard. I would want to run out to Kendall Square and say to everybody, no, they are. And that's a problem because the generic term, what you call them are GLP-1 drugs. That's not a good thing because people don't remember it and they don't know what they mean. And these days they might think it was Chat GPT. Is it a GLP? Is it a GPT? What do any of these things mean? So how am I supposed to remember that? If you're a trademark lawyer, you have this conflicting instinct. You want everyone to have your product on the tip of their tongue so that they ask their doctor for it and they go out and they buy it. I've seen people talk about Ozemp-ifying their diet, which is essentially trying to find drugs that are higher in things that promote GLP or that interact or that have certain substances that are related. I've seen news articles that talk about Ozemp-ifying your way of life. All of these things should make a trademark lawyer shudder because what you're afraid of is the dreaded genericide, which in the parlance of intellectual property lawyers means you lose your trademark.
So Novo Nordisk sells the exact same drug, semaglutide, under two different trademarks for two different conditions. They sell it as Ozempic for type 2 diabetes, even though it's known best as a weight loss drug. But then its weight loss drug is actually Wegovy. I'm curious, why would they need two different trademarks for the exact same product?
When you have two products that are essentially the same active pharmaceutical ingredient, but you have a different trademark, you are selling to two different types of patients, and you want to separate the product. So if you look at the difference between Ozempic and Wegovy, the key difference is that Ozempic is tailored for patients who are diabetics. Wegovy is tailored for patients who need weight loss. So for Wegovy, you can get a higher dose. If you look at Ozempic, the one that is designed more for with the user of the diabetic in mind, then it's also covered by insurance more frequently. Very few insurance plans cover these drugs for weight loss unless there is an associated problem with it. GLP-1 drugs are the modern American gold rush. That the discovery falls somewhere between antibiotics and the fountain of youth. And so there is a lot of money to be made in this area. And when there's a lot of money, there will be a lot of people rushing to the table to try to share in that pot. One of the ways companies protect what they've done and what they've come up with is trademark. We hear about patents. We hear about copyrights a lot, but there are other rights out there that are just as important to a company, and trademark is essential.
Aspirin is an example of a company that lost its trademark, but I didn't see there was that many other pharmaceutical trademarks that have been lost over the years. Is there a reason it happens less often in the pharmaceutical industries and biotech than it does in other industries?
In the pharmaceutical industries, you will often see names chosen that have something to do with the scientific name underneath it, something like that. And I think they don't last in people's minds as much. But there really is a key difference for pharmaceuticals, which is that after a period of time, generics come onto the market, and then the public begins to think of that product area with the generic name, and that can loosen the association between the original trademark name and the product in general itself. And I think that's probably why we don't see as much loss of trademark in the pharmaceutical industry.
Professor Feldman, that was a lot of fun. Thank you so much.
Thank you very much. Great talking to you.
So even though it has certainly become the household name for weight loss drugs, ultimately it's unlikely Ozempic is going to go the way of Thermos or Dumpster or even aspirin. But as the popularity of GLP-1 medicines continues to grow, It will be interesting to see if the name Ozempic continues to be more and more ingrained as a synonym for weight loss drugs. Thanks again to Professor Feldman, that was a great conversation. And I'd also like to give a big shout out to Mehdi Hadri and Stats Design Team for the sick new status report logo. It's absolute fire. If you enjoyed this video, please like and subscribe. We'll be back next week, same stat time, same stat channel.